Hello, I'm Bin, and I just finished my third year in health science, and I'll be entering pharmacy school in University of Toronto. So when I was volunteering in oncology unit this summer, I was talking to a patient and his friend, and then I was talking to him for like 5 minutes, and then he asked me, "So what are you doing here?" So I told him that I'm just a volunteer and we are just here for minor support to the patients, such as talk to the patients to give them comfort if they seem nervous or bored. And I remember the pharmacist saying that I shouldn't call volunteers just volunteers, because even though it might look like volunteers are not doing the major job, and it might look like doctors or nurses are doing the major job or the major treatment to the patients. We should know that the volunteers are equally helpful to the patients, and then the patients would equally appreciate what we were doing to them. So from there I realized that even though the volunteering jobs might look like it's not really a major role, we're not really we're not really treating or curing someone else, but our support that we could give to the patients can be really helpful to them, and then we should know that they really appreciate us. I think the greatest value of volunteering is that we can actually go join the placements, join the actual medical related placement, and that we can see what the medical related professionals do at their workplaces. So for example, I volunteered in ER and oncology unit, so I could see what the nurses and the doctors were doing in ER and oncology unit. So like before that, I just knew briefly about ER by watching Grey's Anatomy or something like that. But at the actual placements, we could actually see what the doctors and nurses were doing. So it gave me it gave me a whole new perspective about the healthcare professionals. And also, one of the key characteristics that many healthcare professionals should have is a communication skill, and I was really lacking that skill. But throughout the volunteering experience, it really improved me with the communication skills. So now I'm not afraid at all to talk to the patients. They really asked me to provide them with real life examples, and then throughout the volunteer experiences, we see a lot of different things. So we would have many examples to tell when we were at the interviews. So, for example, I went to the solidarity trip to Brazil with my fellow Med students, and from there I saw a lot of kids who need other people's help, or I saw the hospital conditions in Brazil, so I could talk about those in the actual med school interviews. Or else I volunteered in ER or oncology unit, so I could talk about some of the patients I met and some of the experiences that I had with the nurses or doctors. So those examples really prepared me to get into the med school or other healthcare professional school interviews.